We have a patient with a knife stab wound our thigh region. For that, when you reach to the patient, check the surroundings are safe. Before touching to the patient, wear PPE kit like mask, gloves, check for the patient responsiveness and call for help. After that, check the patient airway, breathing, the chest is expanding and the circulation. And then elevate the patient leg, and for stopping the bleeding we are applying the bandage using the gauze over the wound. After applying the bandage, we are providing the transportation stabilization for a patient using the sticks and fix it around the leg to avoid the movement of leg. And wait for a paramedics to arrive. Once paramedics arrive, they will perform the neurological examination, check the eye opening response, best motor response, best verbal response, and score patient according to that. Then they perform the head to toe examination like inspection, palpation of a head, neck, chest, abdomen, pelvis, upper extremities, lower extremities, and give conclusion and transport patient to the hospital. Dr. Vishal Patidar, we need to perform a subjective examination. Can I have a patient identity, please? Okay, so patient name is Tanmay. We will check some patient history. So I will ask you some questions like, can a patient have a gastric ulcer?
No.
Have allergy?
No.
Had any blood transfusion?
No.
Smoking?
No.
Alcohol and drug abuse?
No.
Has family health history?
No.
Has diabetes mellitus?
No.
Had any operation recently?
No.
Had tuberculosis?
No.
Stroke?
No.
Myocardial infarction?
No.
Hypertension?
No.
He is taking any medicine or not?
No.
After the subjective examination, we are performing the objective examination starting with the general inspection. So we know the patient condition is critical due to the pain. Now we are checking the patient consciousness. So what's your name?
Alright.
Do you know where are you?
Yes.
Raise your hand. Down. So now the patient is look like their age. Their skin is a pale. Joint. We obtain data of a general inspection. The condition of a patient is a critical. The consciousness we read the 13. The patient look like its age, skin is a pale, mucous membrane is dry, and other things are normal. Now we are doing the objective examination of a respiratory system, starting with a general inspection from a front, from the back, checking the respiration rate, performing the palpation from front and back, doing the percussion and auscultation. Now we are doing the objective examination of the cardiovascular system, starting with the pulse rate, checking the blood pressure, performing the palpation, percussion, and auscultation. Now we are doing the objective examination of the GIT system. So after objective examination, we obtain the following result: the cardiovascular system, respiratory system, nervous system, and GIT system looks normally. Now we are looking for a local status. So the location is on the right leg, the color is pale. Must check for the pulse presence, check the local temperature, numbness, regional sensitivity, and record data which we obtain. The subjective objective examination take a local status. Now we are checking the wound description. So we are remove the dressing and examine the wound for a presence of foreign bodies and the variability, and classify the wound according to location, character, contamination, and see which type and stage of a wound. After the wound description, we will do the further investigation, such as we perform a laboratory and instrumental examination. For laboratory, we will do the complete blood test, check the blood counts, cholesterol level, glucose level, erythrocyte sedimentation rate, leukocytes. We will check a blood group in case we need a blood transfusion. Then perform an instrumental examination such as MRI, angiography, CT scan. This picture shows the wound. Then for the treatment, the position of a patient leg should be elevated. The physical activity is rest. The diet of a patient should be NPO. The medical therapy is required to target the symptoms, and we need to perform a surgery. Without surgery, the chances of a patient survival is less. Therefore, for the management plan, for the medical treatment plan, we we need to monitor the urine output, respiratory rate, oxygen, and the carbon dioxide monitoring. We will start the IV axis, start infusion therapy, and then for surgical treatment plan, first we will take off the bandage and dressing, to draping, then do wound irrigation, administer the regional spinal anesthesia, then control the bleeding, do debridements, and look for the wound closure by the primary or secondary intention. As it's need to do surgery, for that we need an informed consent from your side. After that, we are starting to do the pre-operative examination. Always remember to take informed consent and perform pre-operative examination before surgery.